McLeod Health presents Count on Health.
So ACL is one of the most common type of sports injuries I'll see and evaluate. Classically, they happened when an athlete plants their foot and pivots on it. It generally does not require or occur with contact, and the athlete will feel a big pop in the knee. The knee will become very swollen. They will not be able to walk on it. When an ACL tears, it for the most part, fairly obliterates the ligament. There are a few cases where repairs are now being considered where most of the ligament is intact. But for 90% of athletes, when they tear the ACL, there's very little ligament left to repair. And so we have to rebuild the ligament. We call that a reconstruction. The recovery after an ACL reconstruction is probably the hardest part of the whole process. Most athletes and patients after a week or two are walking on the leg with no pain and near full range of motion. Occasionally, if a meniscus repair has to be undertaken, there'll be more limitations for 4 to 6 weeks about bending and weight bearing as we let that meniscus heal. But almost entirely everybody by 2 months is feeling like they should be allowed to run. The issue is that the ACL is not strong enough, and if they step in a hole and twist their foot the wrong way, they will simply re-tear the ACL. During recovery from an ACL, physical therapy is really the main treatment, and therapy is absolutely essential. It's essential for return of proprioception and quad strength. It's essential for return of full motion. It's essential for sport-specific training. The therapist has a very large and expanded role after the surgery is complete.